Stroke is a non-communicable disease, and it occurs when the blood supply is interrupted by either occlusion, which is known as ischemic stroke, or hemorrhage. And the stroke patients often have long hospitalization and lasting physical and cognitive impairments of variety severity. Okay, and a multidisciplinary team is involved in stroke rehabilitation, including like physiotherapists, occupational therapists, speech therapists. And the improvement of patients can range from minimum to complete. Physical therapy is widely recognized. However, like not one approach has proven to be more or less effective, and a mixed approach tailored to patient needs is often adopted by the physiotherapist, and 30 to 60 minutes, 5 to 7 days per week, and focus on patient's specific task has shown to be most effective for stroke patients' recovery. Acupuncture is a relatively new approach for stroke rehabilitation. It's widely used in East Asia and is recommended as an adjunctive treatment by the WHO. Acupuncture on particular acupoints may be excitable muscle, skin nerves, complexes, containing a high density of nerve endings, and then activated the afferent fibers that sending the signals to the spinal cord, and may have impact on regulation of cerebral blood flow. Since it have impact on the cerebral blood flow, so it's not good for the hemorrhage stroke. So we're only working on ischemic stroke. And the neurochemical response of acupuncture is depending on the intervention timing, acupoints, manipulation, needle restraining time, acupuncture interval, and pulse. And acupuncture balances the yin and the yang, and the yin like refers to the dark, and the yang refer to the bright. And then like in our culture, we believe like the universe is balanced by yin and yang, and like the sun represents for the yang, and then the moon represents as the yin. And then like our body is balanced for yin and yang. If it's not balanced, so your body gets sick. And then like acupuncture can like help to balance the yin and the yang of your body, let the body cure itself. So Deqi also like Deqi is actually a Chinese word, and like it means like received energy. So like Deqi is the core concept of acupuncture. It's a composite of sensations including soreness and numbness, distension, heaviness, and other sensations. And the Deqi associated with positive outcomes of acupuncture. So normally the acupuncture practitioners will ask the patient, do you feel the energy or like the Deqi? If you don't feel it, which means like you don't really have the positive like outcomes. So like Deqi is like the core concept of acupuncture. Okay, and previous study have shown stroke patients following acupuncture treatment shown like improvements in balance, decreased spasticity, increased muscle strength, and greater mean blood flow velocity in the brain. Since acupuncture therapy does not require expensive equipment or infrastructures, it is ideal suited to resource-constrained countries like lower middle income countries such as South Africa. However, as widespread adoption is like hampered by limited understanding of the mechanism whereby it may improve outcomes. So the aim of the study is to address these concerns by advanced understanding of the neural correlates underlying function improvement associated with acupuncture treatment. Patient will be random into one of the three treatment arms. So it's a standard physiotherapy, PT, and PT with true acupuncture, and PT with verum acupuncture is for the placebo effect. The objective of the study is to examine within subject change in pre-visit versus post-intervention, and to assess whether like true acupuncture alters physical outcomes, including muscle strength, muscle tone, and or balance, compared to patients receiving PT only or PT with like verum acupuncture. And also to assess whether like a true acupuncture alters brain functional and structural connectivity compared to patients receiving PT only or PT with verum acupuncture. Like in the end, we like to examine whether the improvement in physical outcome are associated with the brain alterations. Yeah, 60 ischemic stroke patients with unilateral limb dysfunction will be recruited from the Western Cape Rehabilitation Center. Yeah, an overview of the testing protocol is shown here. At week 0, so it's a pre-convincing any treatment task, any treatment. So we will acquire a set of MRI images as well as a set of the PE stands for physical examinations. And then after that, the patient will have 6 week, will take the 6-week rehabilitation program. And then by the end of the treatments, they will undergo another set of physical examination, and also we will require another set the MRI images. So the inclusion criteria includes the male or female first stroke patients aged between 40 and 65, suffering unilateral limb dysfunction following a medium ischemic stroke in basal ganglia and the motor cortex. Patient will be enrolled within 4 weeks after stroke on site. WHO criteria will be used for stroke diagnosis. The extent of unilateral limb dysfunction should be such that patient must be able to walk with a walking frame and drives with and without assistance. Only patients eligible for 6-week rehabilitation at WCRC will be recruited. And WC is very supportive to the study, and they will make sure all our participants will stay for 6 weeks, because some of them could be, discharged like before 6 weeks, like because they got really good outcome, they can be discharged. But since we conduct study like to investigate a 6-week rehabilitations on stroke rehabilitation, they will make sure all the patients will stay for 6 weeks. Okay, the patient with intracerebral hemorrhage will be excluded, and exclusion criteria including corpus callosum stroke, dependence in activities of their daily living before present stroke, inability to complete a scheduled treatment course, infection in acupuncture sites, severe aphasia or unconsciousness, making it difficult to comprehend the study or cooperate in evaluation. Other severe complications such as heart, renal function failure. And HIV positive and diabetic limbs, unwilling to undergo acupuncture or sensory sensitivity, multiple strokes, previous clinical stroke, including small strokes noted in the MRI acquired from the study, undergoing the thermal boluses and the thermobectomy. And any patients have like implant made in metal will be excluded, because we will conduct MRI on these subjects, and then the strong magnetic field of the MRI will either broke the implant or will pull the implant from the body, so which is dangerous for the patient. So we won't include them. They will be excluded from the study. Yeah, prior and posterior to commencing rehabilitation treatments, a physical examination will be used to assess impairments. We also acquire a comprehensive brain MRI imaging. Dr. Ma from UWC with like other 3 South African registered Chinese medical doctors will perform true acupuncture or verum acupuncture on which patient due to their schedules. All these Chinese medicine doctors will be trained particular to ensure the same acupuncture protocol that be implemented to the patients. Physical therapists at WCRC will conduct physiotherapy on patients. However, there are 14 physiotherapists there. We will try to limit the number of them. Okay. 醒脑开窍 is like a word, Chinese word, acupuncture procedure is widely used, widely accepted for stroke rehabilitation. And a 醒脑开窍 acupuncture protocol have been consulted with our Chinese collaborator, Prof. Chun Hongzhang from Tianjin University of Traditional Chinese Medicine in China. And together, we received South African China joint research program, and they will conduct a bilateral study there. Only the difference is acupuncture is compulsory in China. So if patients have stroke, and they will go for acupuncture treatment, not physiotherapy. And they will 3 treatment arm, including acupuncture alone, acupuncture with physiotherapy, and physiotherapy with verum acupuncture. Actually, when they apply for the ethic approval, they have a hard time because in China, acupuncture is compulsory. You must have acupuncture. But since they want to control for the placebo effect, so after long, negotiation, and then because PT is worldwide recognized for stroke rehabilitation, and then they allow them to do the physiotherapy with verum acupuncture. And this protocol has been invented by Prof. Yin Hong Chang from Tianjin University of Traditional Chinese Medicine and her co-investigator from Germany and Switzerland on healthy subject using MRI. Okay, the IQ points including PC6, GB26, SP6, BL40, GB34, and GB40. So that's the code for the different acupoints, and anatomical sites of acupoints are shown here in this picture. Okay, and the single-use acupuncture needles and the electron acupuncture will be applied on certain acupoints with certain retaining skin penetration, electricity output, or needle manipulation for subject to receive their qi. Yeah, so the acupuncture practitioner will ask, do you feel the energy? And if you do, that means it should work. Okay. So like for the verum acupuncture refers to placebo acupuncture. And then the verum points are like 10 millimeters lateral to 5 acupoints and 5 millimeter horizontal to the GB26. And without retaining needles, skin penetration, electricity output, and or needle manipulation for dirty, so they don't feel dirty because dirty is associated with positive outcomes. Okay, like a set of MRI imaging will be acquired, including high resolution structural T1 imaging. And then this allowed us to investigate the volume change of the stroke regions. And the functional MRI allowed us to investigate the function connectivity changes in certain brain matter regions. And the resting state functional MRI refers to a subject not perform any task, but we can still find the simultaneous brain function connectivity in certain brain regions. So which is more ideal for the study. And then it allowed us to investigate resting state functional connectivity in the gray matters. We want to see the change inside of the subject and then between the 3 treatment arms. We will using independent component analysis and then seed-based analysis. So let's talk about seed-based analysis first. So the seed-based analysis, like short for SCA, we will use the stroke region as a seed to do simultaneous to find in which part of the brain region simultaneously functioning with the stroke region. We will do the voxel-wide analysis to find like the cluster showing significant differences between like a pre versus post intervention, as well as like between the three treatment arms. And the independent component analysis. So like when we collecting the resting state, the RS functional MRI data, so it's like the mixed functioning connectivity like a data. So like it's more like the mixed cocktail. The ICA, the independent component analysis, more like you let your cocktail to set down, you will see different layers. And when you slice, you will get different function connected networks. And then we will investigate gray matter changes within this network to see there are like potential benefits of acupuncture treatments. Okay, and the diffusion tensor imaging allows us to investigate white matter integrity changes, and also like once we find the cluster or regions showing significant differences, we will do the tractography and then see the white matter track path through this cluster and which brain region is connected. So the deficits in the gray matter region could be related to the track connecting this like green matter region. So like we will combine our resting state results and our diffusion tensor imaging data result to see like deficit, whether it's only because it's not the green matter not functioning like, or it's just because the connection like the connection between these regions like it's been like damaged due to the stroke. And the last but not least, we will do MRI spectroscopy. It allowed us to investigate the biochemical changes in the stroke regions. Okay, and the physical examination, including NIH stroke scale and score, Fugal May assessment that is allowed to standardize the level of sensor motor function, modified Ashworth scale, and for the specificity, muscle strength, Barthel index, and then the physical examination will be video recorded for quality assurance to ensure like inter-test reliability and also for training purposes. Okay, so all the MRI and the physical examination data will be used to determine whether adjunctive acupuncture treatment improve physical outcome and the brain structure and the functional connectivity. We will examine subject within the subject changes pre and versus post intervention and between the three treatment groups, and also to examine whether the improvement in physical outcome associated with brain alterations. Okay, so far we have received 4 research grants, including our NRF Tutuka South African China Joint Research Program, Harry Crossley Clinical Research Fellowship, and the Startup Emerging Award. So I'm the PI of the study. Ernesto will oversee the like the imaging process, and Professor Mark Combrink will be the neurologist of the study. He will be in charge of the like recruitment and randomizing the patient into the 3 treatment arms. Dr. Fleur Wharton, she is expert in neuroanatomy. She will be in charge of the T1 structure imaging analysis. Francis will be in charge the MR spectroscopy study. And then Mr. Leon Hector is a clinical educator from physical therapy, and he will in charge of the physical examination. Dr. Xuesheng Ma is a senior lecturer at the UWC, and he will be director of the acupuncture treatment together with other 3 Chinese doctors from UWC. And Chunhu Zhang is the PI from our Chinese side. And then Dr. Hai Lu is from he like from Tianjin University of Traditional Chinese Medicine, or recently got the post from Nanjing University. Okay, so I'm also conducting another study because I want to adopt these techniques in our future study. So the title of the study is Correlates of Facial Brain Dysmorphology in Children with Fetal Alcohol Spectrum Disorders. So like you may know, the fetal alcohol spectrum disorder without the mother like prenatal alcohol exposure, and then children always show like distinctive facial figures. And then previous study have shown like the brain damage caused by the prenatal alcohol exposure. But what the relation between the facial figures and the brain alterations is remains unknown. And recently, like researchers from Leuven University in Belgium, they reported like 7% of genetic information in the facial figures is currently significant correlate with the brain figures. So like our study is want to find the face brain dysmorphology in these children with fetal alcohol spectrum disorder. And we will use statistical shaped models, robust tools for extracting and explain shaping between biological structures, facilitate accurate brain segmentation and facial shape analysis. And so we will conduct a study like in facial brain morphology using MRI. Yeah, recently, people reported that gravity has impact on the facial soft tissue. So we will conduct another like study to investigate like whether the subject like lying down and sit up, and what does the facial soft tissue changes using the 3D photographic images. And also we will collecting MRI images in the meantime to see like we can actually conduct our study using MRI, or like differences not really in the region that we are interested. Yeah, we will adopt this technique because like stroke can causing facial paralysis, and acupuncture have shown impact on the facial figure changes. So we will conduct a static shape model analysis on the MRI imaging collecting on the stroke patients after a acupuncture treatment. So the patient will be with central facial paralysis. So we want to find the differences pre and post intervention, the acupuncture intervention, and between the 3 treatment arms used in previous study. In long term, we want to create an atlas, so allow us to use facial dysmorphia to predict brain alteration that will help us the diagnosis. Thank you.